Hello, I'm Tana Baker. I am in Term 2, Section 1, in Professor Wachowski's class, and today I'll be demonstrating an NG tube insertion. I have already checked the orders. The doctor has ordered a double-lumen saline pump tube to be inserted for suctioning. Everything's prepared. I have my things with me. I'm going to go into the room and introduce myself and introduce my patient and get everything ready. Okay, go into the room, wash my hands. Hello, Mr. Jones. Can you go ahead and tell me your name and date of birth?
Tom Jones, 9/23/65.
Wonderful. That's exactly what I have. And how are you doing, Mr. Jones?
I'm doing good, actually.
Okay, well, I'm here to insert an NG tube into your stomach.
Okay.
It's going to go in through your nasal passage, and it's going to be hooked up to suction so we can kind of decompress any secretions that you have going on. Is that okay with you?
Yep.
Wonderful. I have this towel. As you can see, my patient is already in hyphalar, so I will not have to move him. Okay. If you could just take a snip in for me. Okay. One more. Wonderful. And have you had any surgery, rhinoplasty, deviating septum?
Nope.
Wonderful. Do you have a preference as to which nair I use?
Whatever's easier for you.
Oh, I love it. Okay. I'll wash my hands. I'm going to check this first. Take out my tube. Go ahead and measure. And I will make sure this is going to be measure from the tip of the nose to behind the ear. Will be about all the way down to the xiphoid process. Let me give myself a little wiggle room with about an inch and mark my spot. Okay. That's what we have. I'll put my gloves on. Okay, now I have some lube here. I'm going to lube one end up to about 4 inches from the curve cut. Okay. Now, Mr. Jones, if you could just tilt your head back just a little bit for me. Okay. 30 minutes. All right. 30 seconds. Now let me know if you have any discomfort. I can pause the video. Okay. Good. And then, wonderful. We're going in. We're approaching the throat. This is going to be okay, just open wide for me. Yep, we're definitely in there. Okay, now I'm going to have you lean your head forward for me and take small sips of water. I'm going to swallow at the same time. Now, if the patient gags or coughs, I would retreat a little bit and then I would give him time to recover before proceeding. But he's doing just fine, so I'm going to keep him moving. I'm all the way up to my tape. I'll just temporarily tape it to the patient. Okay. I'm going to check my placement. First I'll ask him to speak. How are you feeling, Mr. Jones?
Feel good.
Great. My stethoscope ready and my syringe ready. Bring it in. And then no chlorine. And I'm also going to report or document the patient's response. And I'm going to come back and check. I'm going to aspirate. Okay, wonderful. I have what appears to be brown green stomach content. I'm going to reintroduce that to the stomach while I auscultate in the left upper quadrant. Okay, I hear a gurgle. Wonderful. Still feeling all right?
Yep.
Perfect. Okay, I'm going to disconnect that. I'm going to go ahead and pull this off here. And I have some tape to go around your nose in a butterfly fashion. Okay. All the way around. Keep it down. And then I have a rubber band and a safety pin, and this tube actually isn't long enough, so I would pin this to the patient. And I would connect this up to low intermittent suction as prescribed by the doctor. Okay? And then I would make sure there was anything else needed, clean up my area, He doesn't need anything, so I'm going to remove my gloves and clean my hands, and I'm going to document. I'm going to document, excuse me, the time of insertion, the length of the tube that was inserted, the size, the type, the color and consistency of any drainage, and the amount that I received, and how the patient tolerated the procedure, which he did very well, and any instructions I gave him, which was to relax at this point. Okay. Now, the patient is still in high Fowler's. I've come back because it is time to flush this NG tube. How you feeling, Mr. Jones?
I feel good, thanks.
Can you verify your date of birth and name for me one more time?
9/16/65.
Okay, wonderful. I'm going to flush your NG tube just to kind of keep it clear of anything.
Okay.
Okay? So first I'm going to put this towel down. I'm going to clean my hands, put some gloves on. And then I'm going to disconnect your suction, your NG tube from the suction. I'm going to place this right here. Okay? Now I'm going to aspirate. Okay, I've got about 10 milliliters of stomach contents, brownish greenish fluid. I'm going to reintroduce that back into the stomach while listening to the last upper quadrant. Okay, I do hear the gurgle. The placement is still very nice. Now I'm going to draw up 30 milliliters of sterile water. Okay, and I'm going to flush the NG tube with 30 milliliters. Okay. Now I'm going to withdraw those 30 milliliters. I went a little far. I got 35, but that is all right. I'm going to discard this and hook his NG tube back up to the low intermittent suction. How was that, Mr. Jones? You feeling all right?
I feel good, thanks.
Okay. Now I'm going to clean up my area. Mr. Jones will not be put less than 30 degrees. So right now he prefers to stay in high Fowler's. I'm going to remove my gloves, do my hand hygiene, take everything out of my patient's room, and it's time to document once again. I will document that I use sterile water as my irrigation solution. The difference in volume, I put in 30 milliliters, I got back 35, so 35 would be removed from the intake, or output rather. Characteristic, it was brown and green, and stomach content. There was no difficulty, and the client responded very well. He did just fine, and now he's relaxing.